Dr. Leena Deshpande is a developmental pediatrician. She is currently practicing in MGM Hospital and the Deshpande Child Care Clinic. Having done her MBBS in Mumbai and her MRCP in London, she specialized in developmental delays in children, attention deficit hyperactivity disorder, autistic spectrum disorder, cerebral palsy, and learning disabilities. Her aim is to spread awareness about developmental delays in children, thereby leading to its detection and treatment at the early stages. She's been involved in various awareness camps held in schools regarding learning disabilities and ADHD. She's also done numerous television programs to increase awareness regarding ADHD. She teaches medical students and special educators on the aspects of scholastic backwardness. In this video, Dr. Leena Deshpande will tell us more about developmental pediatrics and what this particular field of medicine involves.
See, what happens is once a child is born, he starts attending various milestones. He starts holding his hair, he starts rolling over, sitting and then walking, starts smiling, babbling. As he grows beyond 1 year of age, he starts speaking. He starts saying words and then sentences. He becomes bigger, he starts attending school and starts learning more and more complex things. Now, there are some conditions which are neurological or genetic or hereditary in origin which interfere with this smooth progression of the child's development. Developmental pediatrics is that branch of pediatrics which deals with children who have problems in their development and behavior and consequently in their learning ability. And developmental pediatrician is the one who deals with these children.
Now that we know what developmental pediatrics is, the doctor tells us, are developmental problems in children common?
Yes, unfortunately, they are very common. The prevalence of developmental problems in children is somewhere between 10 to 20%. Problem is, they are not being picked up very quickly, very early. Once the child is born, the parents are very focused in feeding the child, sleeping issues, weight gain. On the way somewhere, developmental problems can be missed. Also, parents are not very well aware of what is expected of their child at certain ages. So as a result, they seek help quite late.
So what should the parents look out for?
If the mind doesn't know, the eye will not see. So it's very important that all parents should be aware of what is expected, what is a normal developmental pattern in all children. They should know that, say, physically, a child should be holding his head, should have complete head control by 5 months. The child should be sitting unsupported by 9 months. The child should be walking independently at least by 18 months. Speech-wise, the child should be having at least 1 word by 1 year, 2-word phrases by 2 years, and 3-word sentences by 3 years. So if this is not happening, this is the very least. And if this is not happening, the parents should seek help. There are a lot of online resources which will give information about normal developmental milestones in children, and parents should access this and see whether their child is meeting expected milestones. They should also discuss the child's development with their pediatrician, who should be able to pick up these problems early and refer for further assessments if necessary.
Sounds interesting. So doctor, what are the different types of developmental delays you commonly see in your practice?
There is a range of problems which children with neurodevelopmental problems come with. Children may have developmental delays in their physical skills, in their speech and language skills, or they might have what we call as a global developmental delay. We also see children with autistic spectrum disorder and autism, cerebral palsy, attention deficit hyperactive disorders, learning disabilities like dyslexia, dysgraphia, etc. Then there are various syndromes which are associated with developmental problems in children like Down syndrome, Fragile X syndrome. Children who have various neurological problems like epilepsy also are at a high risk for developmental problems, and hence these children should also be monitored very closely.
How important is it that these problems are detected early?
See, it's very important. It's extremely important that these problems are detected early, as early as possible. The reason being, early detection leads to early intervention. And early intervention in many studies has shown that it improves the long-term outcome of a child with neurodevelopmental problems. Recently, we have discovered this concept of neuroplasticity. Neuroplasticity means brain plasticity. The ability of brain to organize or reorganize itself after an injury to it. So if we stimulate the brain in the right way, very soon after injury, the right kind of intervention does help the brain to reorganize, new neurons to form and take over the activity of the problem area. In simple words, early detection, early intervention, better outcome.
So doctor, tell us, should all children have regular developmental checkups?
Absolutely. Just like every child has his height and weight measured at the doctor's visit, every child should have his developmental check at every visit of the doctor's, or almost every visit. So routine developmental surveillance is essential to pick up children with problems. We have a group which is called high-risk children. These are the children who've spent some time in the intensive care, in the neonatal intensive care due to any reason. They could have been premature, they could have been low birth weight, they could have had high jaundice, infections, sepsis, needed oxygen. For whatever reason they have spent their time in intensive care, these children are at a higher risk than normal population to develop neurodevelopmental problems in the future. So these children definitely have to be kept under a very close developmental surveillance, at least for the first 2 years of life, if not more.
Found our information useful? If you find the video helped you, please like it. Tell us what you think about our videos. Please leave a comment. To watch our other videos, click here. For more on your health, log on to health.india.com.